Good morning and welcome again. My name is Liz Colway. I'm Manager of Community Building and Digital Engagement at Sabin. We're excited to present this webinar on country perspectives on turning on and off immunization services during COVID-19 in partnership with JSI. Before we launch into the discussion, I just wanted to go over a few logistics and then a brief introduction of Boost before I hand it off to Lisa Oud of JSI. So first things first, please do introduce yourself. If you could type your name and location into the chat box. We'd like to see who's joining us from around the world. A reminder that you can submit questions during the webinar through the Q&A button located at the bottom of your screen. You can also respond to questions and engage in the discussion at the chat as well. So that's the box that you're typing your introductions in right now. And then finally, during the live Q&A session, if you would like to speak, you can raise your hand and we'll give you permission. We'll unmute your line so you're able to direct your question at one of our speakers today. And if you have any technical issues or questions, just also chat them to our panelists and we'll try to get back to you to make sure everything's working. Just going over the agenda, as I mentioned, just doing a few welcome remarks and logistics. We'll have some speaker introductions, and then we'll launch into a moderated Q&A session. So you probably noticed in the registration form, we had asked you a few questions. We got a number of responses for people who had registered. So we're gonna start first by answering your questions. And then we'll next launch into a live Q&A session. So if you have additional questions that come up throughout the discussion, again, feel free to use the Q&A box or the chat functions to share your questions. And then finally, we'll close out just with a few next steps and resources. So I believe probably many of you heard about this webinar through the Boost community, but if you are new to Boost, I just wanted to share kind of a little bit about who we are and how you can join. So Boost is an on and offline platform that connects immunization professionals to peers, supports and resources to learn and grow, and also equips professionals to lead in challenging situations. So our three main pillars of the platform and our initiative is one, to really connect peers and stakeholders in order to expand your professional network. Again, I mentioned learning as well. So providing access to experts and resources to help you learn skills to both build your capacity and also advance your career. And then last but not least, Boost is designed to lead, to help immunization professionals lead in immunization programs in challenging contexts such as COVID. If you haven't already joined, please be sure to sign up through boostcommunity.org. It is free to create a member account. And once you create that account, you'll have access to all of our resources and discussions behind the firewall. So definitely would encourage you to check it out. There's a lot of upcoming events and discussions going on, so would love for you all to be part of those conversations. And then also, just a note that this webinar today is brought to you by Boost's new learning group on the platform called Supporting Supervisors During COVID-19. So once you've been able to explore the Boost platform, you'll notice that there are a number of learning groups around different topics. So this one in particular is geared towards supporting supervisors during this, as I mentioned, quite challenging and complex time. So I would encourage you to navigate to the Learn and Lead tab on the Boost community platform. And from there, you can choose to join. You'll see it highlighted on your screen, this group. And joining just means that you'll get notifications whenever we have webinars like this one that come out, or other kind of key resources to help you with your job and to help lead your teams as well. So we definitely encourage you to join that group when you have a chance. Okay, and that leads us to our webinar today. So in the last several months, we've worked with partners like WHO to share out their global immunization pulse survey. We've also been getting feedback on the Boost platform as well as to what the situation is currently on the ground. And from what we've heard from you all, we've heard that there's been limited access to updated resources or guidelines from verified sources. We've also heard that there are just too many resources that exist, and it's hard to find relevant information that can help you. And there's also been the strong desire to learn from other countries' experiences, specifically around challenges like infection prevention and control, vaccine demand and hesitancy, supply chain concerns, a return to routine immunization, and then the new COVID-19 vaccine. So this webinar today is to really, address some of those concerns that have been raised through those surveys and on our platform. So we're hoping, hearing from these different country perspectives today will help you as you think through how to, one, roll out this new vaccine, but then also just return to those routine immunization services. So with that, I want to hand the mic over to Lisa Oud from JSI, who's going to introduce our esteemed speakers for today. Over to you, Lisa.
Great, thank you, Liz. Hi, everyone, and thank you all for joining us. I'll say good morning, good afternoon, and good evening. And we have 3 featured speakers from our JSI country programs. And so I will actually ask that each of our expert panelists say hi and introduce themselves. Please let us know where you're coming from, and also your role with JSI and your role with supporting the Ministry of Health as well. And I'll just say, I'm Lisa Oud. I'm a Senior Technical Officer with the Immunization Center at JSI. So let me start with Amos. Would you like to say hello?
Yes, hello all. My name is Amos Chwea. I am based in Nairobi, Kenya. I work for JSI as a Regional Immunization Technical Officer with a bias towards immunization supply chain. Thank you for having us here.
Excellent, thank you. Dr. Betwell, do you want to say hello?
Hello, everyone. My name is Betwell Sigauke. I'm based in Mozambique, in Maputo. Maputo is the capital of Mozambique. I'm the project director of the JSI. We are supporting the Ministry of Health on immunization, especially on implementing the Red Rec strategy right now. Thank you.
Great, thank you. And our last speaker, Dr. Preetu.
Hello, everyone. My name is Dr. Preetu Dalaria, and I work with JSI, and I'm a director for Immunization Technical Support Unit. It is a secretariat to Ministry of Health and Family Welfare in India. And we are basically providing support and working directly with the ministry for all components of routine immunization in India. Thank you.
Excellent, thank you. So as Liz mentioned in the introduction, we will be responding to the questions that you all have posed to us when you registered, and also to questions that we've been receiving from healthcare workers that we've been working with in countries and health managers. And so we've tried to focus on 3 key areas of which we're getting a lot of questions. So one is vaccine management and how to address stockouts. The next is, how do I create a response plan to catch children up with immunizations if they have been missed due to the COVID-19 pandemic? And the third one is, how do I monitor service interruption to examine and determine where services have been interrupted to then target programming to catch up those children. So our 3 expert panelists will be speaking about those 3 topics, and there are a series of questions that we'll go through. And as Liz mentioned, these are prescriptive questions that we've taken from the questions when you all registered. Please do, as we're going through the questions, write your questions or comments in the Q&A, because after this structured session, we will plan to have a live question and answer period where we will be responding to your questions and comments. So without further ado, I think we'll start. And my first question, I'll start with Amos. So we received several different questions about vaccine management. And the first question is, If a country has experienced significant service interruption due to COVID-19, what are strategies to manage vaccine distribution to ensure that all children are caught up and that the country does not run out of vaccine? How should districts determine how much vaccine is needed to reach children missed due to service interruptions? Amos, over to you.
Thank you, Lisa. Yes, and it's sad to see that we have pandemics that are causing disruptions within our immunization services. It's happening and we need to deal with it. Now, ideally, a well-functioning supply chain should have the ability to resist disruptions and be able to recover to operational capacity after such disruptions do occur. Ideally, the role of a supply chain is to basically ensure that we manage our vaccines effectively and we make sure we have enough stocks within our supply chain. We make sure the potency is good by taking care by monitoring temperatures, and more importantly, maintaining an adequate logistics management information system. This is what tells you how much you are consuming, where are the stocks, when do I need to place orders to resupply the stocks that have been consumed, and so on and so forth. So coming back to the question, I want to say that every program must be planned strategically to make sure that when such disruptions do occur, you are able to resist them and recover. So for countries, immunization supply chain, for us to recover from such disruptions, we need, first of all, to know who are our targets. How have we been performing over time? What has been our coverage periodically, monthly, quarterly, yearly? What has been our coverage been like? Then look at that and see if your coverage has gone low. It has gone low by how much? How many children or clients are we missing? Have we missed during this period? So having established the number of clients we have missed during that period, that will inform what kind of stock that you require to reach them. Again, you come back and look at what are your current stocks like? Are they able to address the missed children or clients? So that you are able to connect the number of children that you have missed with the stocks availability. In most cases, you may find that you have missed more children, you may require more vaccines than your cold storage can hold. So you again need to plan again, how am I going to have these vaccines come in? You may need to increase your orders so that if your equipment cannot hold the vaccines for the number of children that have been missed, you may think of increasing the number of orders you are placing from your supply, your immediate supply level. Again, it's again very important to know what strategy are you going to use to reach these children. Are you going to have more outreaches? Are you going to have an intensified vaccination week or something like that? So that you are able to make sure that you have supplies that will meet the demand. And the demand are these children or clients that we have missed over time. Again, you need to make sure that you have enough buffer stocks within your storage system so that as your stocks go down, you have time to order supplies from the next level, having known the lead time, the time it takes from the time you place an order and the time the vaccine comes into your store, so that you don't have at any one time to stop immunizing because you don't have sufficient stocks. So I guess one very important thing is to know your stocks, to have visibility of your stocks. Where are my stocks? What do I need? Am I able to address my gap with the stocks that I have? If I'm not, what should I do? make more orders? And again, is my supply level, the next supply level, able to meet my demand? So it's also able to communicate the same upward, so they know that this area will be requiring this amount of vaccines at this given period. Again, overall for the country, a country needs to have clear targets and be able to honor your supply period from the manufacturers, so that you don't have a delayed delivery of a vaccine, which will be needed to vaccinate children and within that region or that country. So it's very important to make sure that your forecasting is perfect, and your delivery schedules are honored, and that you have enough storage capacity to store those vaccines, and make sure that your pipeline, your visibility within your pipeline, you know where vaccines are, which vaccines are where, and you are able to know even within a given catchment area, who is holding which amount of stocks, so that in case one facility is running short of stocks, you can redistribute stocks within the facilities. I want to stop there.
Excellent. Thank you. Thank you, Amos. So our next question is for Dr. Betwell, and this question really focuses on strategies to catch up children who have missed vaccination due to COVID-19. Many health workers now have a plan in place to catch up children who have missed vaccination. We've heard that from those of you who have registered, that there are plans in place. However, there has been a lot of commentary that despite having a plan in place, it's incredibly challenging to implement the plan because of time limitations, increased work demands, lack of human resources, a number of other issues. So Dr. Betwell, what strategies have you used in Mozambique to overcome these types of obstacles and actually implement response planning that has been put in place?
Okay, thank you, Lisa, for this question. As you all know, we are really in a difficult situation due to the COVID-19. And JSI in Mozambique supported the Minister of Health to conduct impact analysis to access or to measure the real impact on different components of routine immunization. And the evidence showed that the immunization services in Mozambique have been disrupted. So to address your question, it's important to develop micro-planning that need to be well planned. And it's important also to consider the existing resource, especially at the ground level. And after that, the districts or provinces was involved in the micro-planning process. The reason to involve a district and manager in the micro-plan of health facility, it's important because it will allow to jointly identify and reallocate the additional resources needed for these priority facilities. So it's important to identify what is the districts and what is the facility are critical in terms of disruption of routine immunization service. And then also the Minister of Health at the national level also was engaged to revise the HSS fund and reallocate for the priority district in order to support the facility that need to implement the specific strategy to recover the program. And human resource are challenged, you're right, but what we did, we calculate or we measure in terms of planning the real time necessary or the timeline necessary to implement the strategy. And the strategy was to ensure that the missed children are really identified and also vaccinated. So this is what we did in order to support the Minister of Health in order to respond and implement the plan.
Great, thank you, Dr. Betwell. So now we've heard from Amos on strategies to ensure vaccines are available for catching up due to immunization service interruption. We've heard from Dr. Betwell on how to actually implement a plan. And so now, Dr. Preetu, can you talk to us about strategies to monitor where service interruption is happening, and specifically, what is India doing to identify and target missed children?
Yeah, thank you, Lisa, and thank you for giving me this opportunity. So first, I think I will just wanted to give a glance of the India's routine immunization program. It is one of the biggest public health program globally, and we are targeting something like 27 million birth cohort and 30 million pregnant females every year. And approximately we organize 1 million RI session every month. So the RI sessions which are there, 70% of these RI sessions are outreach and 30% are facility based. Yes, I mean, the disruption has definitely hampered the program in India, and India has, kind of a lockdown for approximately 3 months. And the maximum disruption happened during the first month of lockdown, which was April, where, I mean, all the outreach sessions, I mean, the 70% of sessions, they were like closed. But quickly, Government of India sent a notice and made this important public health program and is essential health services, and asked states to resume the services. So disruption that has happened, I mean, and currently also it is happening, is mainly due to the mobility of health staff and also the beneficiary. Because health staff, wherever they are available, they were also busy in other activities other than the immunization, like for COVID, the contact tracing and all. So it is important for us to kind of monitor the disruption, and we must do it, and we should regularly analyze the immunization data and also tailor our strategies accordingly. So if I talk about the India, I mean, where the strong review support mechanism was established, and review at the national level started. We started with the monthly review meetings with the state through video conferencing. We started reviewing the program in batches with state, where we were discussing and sharing with them the best practices and innovations with their counterparts. Similarly, at the state level also, they started reviewing the program weekly, fortnightly, and monthly by doing the meetings, virtual meetings, and analyzing the district data, and then guiding their program managers to address the bottlenecks. At the district level, obviously, they started doing district task force meetings using the virtual platform like video conferencing, Zoom calls, and etc. So that's how, I mean, very strong review mechanism was set up. We have also opted a few strategies to how to reach the missed children, And approximately, let me tell you that the full immunization coverage, we are missing like 6 million children from month of April to June. So it's a huge number. State has asked its health workers to do the surveys for the head counts and enlisting the left outs by doing a house to house survey, and thus resulting into updating the due list was done. And then they are targeting now to reach out to those children who were missed, and especially they were missed during the first lockdown where program was totally halted. In India, the migration has happened a lot during the lockdown, and a lot of population from the urban area, they moved to villages. So catering to those migrants was also taken up as a very important task. And frontline workers, they use technology like name-based tracking system, IT-based applications to track and to provide RI services for the temporary settlements that were made for those migrants. And the frontline worker were also trained on giving the awareness on immunization when they are going to house to build that confidence into the community. So I will stop here. Thank you.
Excellent, thank you. I think we're hearing really good information from both Dr. Betwal and Prithu about the need to really help our districts redo our microplanning to ensure that we're including any children that were missed. It's a good opportunity to engage, as Dr. Prithu was saying, engage our communities and do head counts to identify where the missing children are and make sure that those children are included in any strategy that we're implementing. And often I think this will include both trying to expand services for outreach and for mobile services so that we are targeting children not just through fixed services, but through expanded services as well. We're going to come back to Dr. Amos with another question on vaccine management. Countries are worried about the resiliency of their immunization supply chain. Can you talk about ways to improve the resiliency of the supply chain to withstand crises like COVID-19 now and in the future? What can other countries be doing to improve the resiliency of their supply chain?
Thank you, Lisa. And as I mentioned earlier, a supply chain should be able to recover and resist disruptions. And for you to do that, you must be able to plan accordingly. Now, talking about Kenya, Kenya is one country that did not have any stock out during this COVID pandemic all the way from March to date. Of course, disruptions interfered with coverage in the months of April, May, June, and of late now we are seeing the coverage coming back to normal, because I think some measurements have been put in place to try to make sure that vaccination comes back to normal, especially for the under ones. But for HPV vaccine, where we have girls in schools, that still remain to be a challenge. So what has Kenya done to make sure that they are prepared for those kind of disruptions? One thing that the National Logistics Working Group did is to revise the immunization supply chain work plan to make sure that they accommodate disruptions of any nature, not necessarily COVID. We may have other disruptions due to flooding and others. So what we have put in place here is to revise our work plan to make sure that we have included disruptions that can be due to either COVID, pandemics, or flooding, or whatever nature of disruptions. And again, what we did is to map out all supply chain activities, prioritizing them according to their level of importance and urgency in order to maximize the available resources within the country. So you might find some activities being prioritized over others so that we can make sure that these kind of disruptions are taken care of. The other thing that the country is doing, and which we encourage all countries to do, is to monitor and restock vaccines and related supplies. We need to make sure that we, as I said earlier, we honor our delivery schedules. We make sure that our cold chain is expanded well enough to accommodate, even to have room to accommodate other vaccines. Of course, repositioning stocks, both internally and within the districts and within the country. Sometimes you might find one region has more vaccines than the other. So using the current vaccine ELMIs that they have, we call it change, that has feasibility up to district level, we are able to know which region is having more vaccine than the other. And if need be, and we see that the higher the higher level is running short of a given antigen, we can now initiate the distribution of that vaccine to other regions that are lacking that. And all this is being done to make sure that we establish the immunization services within the country in case we have the vaccines that are lacking in some areas. On top of that, they have some groups where WhatsApp groups where all supply chain staff do share what is happening. If a given district, we call them sub-counties here, is running short of vaccine, they're able to post it in that WhatsApp group, or we also have another group that if all immunization members immunization staff are members, you can post it there and people are able to see what's happening. And when you are running short of vaccines, you can mention that here, this is what's happening. So we have the WhatsApp groups and the Telegram groups that really help in doing that. One very important thing again is regularly encouraging that people review data, the supply chain data, so that we know what is happening where. I think the most important thing is that we make sure that we have stocks where they're required in a potent state, so that in case of anything like this, pandemic like this, it can be addressed. Over.
Okay, thank you, Amos. I did just want to ask you for Kenya, what has been the extent of the service interruption? You had talked a little bit about that in your response, but how many children? What's the expected number of children that need to have catch-up planning, or that need to be reached through catch-up planning? Do you have a good idea in Kenya?
I may not have the figure right now, but we have a target of 1.5 million children that are supposed to be vaccinated, and we have we monitor our coverage on a monthly basis. So in the month of May and June, the coverage was quite low, as low as 60–50%. So we are assuming that about half of that population for those months was missed. So people will have to plan on how to reach those populations that were that were missed during that period.
Mm-hmm. Okay, thank you. And I'll move now to Dr. Betwell, and maybe we can just start with that too. Can you describe the extent to which service interruption has affected response planning? How many children does Mozambique anticipate needing to reach through the response planning? Do you have an idea of that?
Yes, of course, I have this. As I mentioned before, we did analysis in different key indicators to understand the impact of COVID on routine immunization. And we did the analysis to measure, just to give you an idea, from April to May, because Mozambique have been affected since end of March. And in June we did analysis, and they will look back for the 2 months, April and May, where the COVID measurement were implemented. And just to have an idea in terms of full immunized child decreased by 27%, which represent in 2 months around 6,000 of children that were not fully immunized, that was expected to receive all a vaccine. So, and also we did analysis to check in terms of dropout rate using a different target group. For infants, we use, or under 1, we use the Penta, and the dropout rate decreased by 10%. So this was a comparison between May and April of a COVID pandemic compared to the similar period in the previous years. And this decrease, it's really important for us, because what we have been showing in the program was improvement. So those figure was increased in terms of number of fully immunized, number decreasing in terms of dropout rate. But over COVID, we see different picture that those are going in the different way. And we also did the validation in terms of the proportion of that are correlated with COVID. And we assume that most of this was because of communication of stay home, and also because of the mothers or caregiver were afraid to come to the health facility because of the transmission. So that is the figure that I can give in terms of number. But we have for different key indicators, but it was only for two months analysis to measure exactly what was happening. And we did also analysis to identify where these children are allocated to respond. And we select the district more affected in order to address in our plan.
Mm. So can you talk to me about how important it is to engage communities in the response planning and identifying where missed children are, and contributing to talking with communities about the importance of coming back to and assuring them that health facilities can provide safe vaccination, safe in terms of not contracting COVID-19. Can you talk to me about your engagement of the community and strategies around that?
So let me start first for the strategy that we have used to identify children who have missed after this analysis. So first, we analyze the existing routine immunization data, such as the number of, using the number of unvaccinated or vaccinated children compared to the target, and also assessing the vaccine coverage and also the dropout rate, as I already mentioned. And this analysis we did from a subnational level, which is it's important to have the information from subnational level, focus on poorly performing district. And also within the district, we did focus analysis to the district level to understand the performance of health facility. So we targeted the health facility. The reason to target the health facility is the community are linked to the health facility, which is important. So when we went down to do analysis in the health facility and prioritize the health facilities that are not performing based on those indicators, we moved to the next step in terms of use the vaccination register. So the idea to use the vaccination register, it was to understand where the most children are coming from, to connect or to link with the community. Because most of strategy like mobile brigade or any communication to link with the community, we need to know where the children come from. So from the register, our register also include the contact of the caregiver using the cell phone number, and also we read down the community because we need to know where they come from. So with these, we did analysis to see most of the dropout rate children where they come from, and we link with the focal community to understand and also to plan the intervention. So once we identify the priority communities, once we identify the priority communities or sites, we start developing the micro planning for intervention, and also these help to facilitate the forecast in terms of essential resource needed for vaccination. And we also identify priority concentration where we have to meet. And the concern first was because of the COVID, people will not come, but we use the community actor, which is community leaders and the community focal points, the community health workers, to engage in terms of passing information, communicate with the caregiver to come for this facility. The most challenge was related with the keep those social distancing and also to have the API in terms of prevention. But we work on this in order to provide, to make sure that the prevention for COVID is on place. And finally, it's important also to mention that these kind of analysis, to use the local data, it's really important because you empower the health staff and also promote the effective use of local routine immunization data and evidence-based for decision where you need to go and what resources you need. So that was in terms of strategy to identify and also to plan where we need to go. So in terms of communication with the community, I already mentioned that we use, basically we use the community actor, and also we have the health committee in some places that are already revitalized. And we work with some community where we are not revitalized to identify key leaders that can really facilitate the communication and to make sure that we can communicate people to come using the media, the local media, to communicate with people to come for this place. Also because the stay home message come from the top leader. And also we come back to the we come back to the national level to engage the minister in order to change the stay home message in order to prioritize the intervention that people have to come to the hospital to take care medicine, to have vaccination. So that was those was different strategy that we use to engage the community in order to be to come back to receive the vaccine, whether the health facility or outreach that was planned in coordination with our community. Thank you.
Sorry, unmute there. Thank you very much, Dr. Betwell. And, you know, I think we really want to underscore the importance of doing local planning to identify where missed children are and that engagement of the community to help track those children. As you were saying, you know, it's critically important that they be engaged and that we continue to bring them back into the health system. Thank you. We're going to switch gears here a little bit. We received questions from you all around issues of data quality and questions about whether because of COVID-19, there are additional data quality issues that countries should be aware of. And I'm going to just ask Dr. Preetu now to talk a little bit about whether he foresees data quality issues as a result of COVID-19 that make ongoing monitoring even more difficult, and what are ways that countries can help address these issues.
Okay, thank you, Lisa, for this question. So in India, we use HMS, which is Health Management Information System, for the administrative reporting. We also use another national portal, which is RCH portal. But I think for the routine immunization coverage data, which is reported routinely, is through the HMS portal. During the lockdown period and currently also, I do agree that data quality issue has been impacted by the COVID-19. And the reason for this mainly was due to the non-availability of the HR, and especially in the containment zone. So that was one big reason. And still, because the cases are coming and India is kind of reporting its highest cases nowadays. And so those containment zones, it's difficult for the HR to go and do the data entry into the portal, because data entry happens at the sub-district level. And that's how the data is compiled and reflects at the national level. And also, I mean, due to the, we understand that because of the HR is involved in other activities beyond immunization for the COVID response, this has also impacted the data entry into the portals. But it is important that data is very important to see, to guide us for our action. So how India is addressing the quality issues during this time. So alternate solution other than data entry into the portal, they were opted, like using WhatsApp, emails, etc., to track the tree coverage. Tracking sessions is also very important, because we were not able to held the sessions as we planned because of many reasons, because of the containment zones and the non-availability of HR. So it is important to track the sessions, and this tracking, apart from the HMS, is done through the regular feedback from the district. That's how the state used to track them. Another is the supervision. So during these days, I mean, it is very important, and the supportive supervision is happening, and it's happening through the mobile applications, which is very effective at the moment. And setting up of monitoring and evaluation cell. All these states, they have set up these small cells where they are collecting direct information from ANMs about their RI sessions or village and health nutrition day sessions which have been planned. So this is how we are currently collecting the data from the field. Use of electronic information registration, definitely, I mean, it is the answer, because it is the fastest mode for us, which can quickly give us the feedback where and how we are missing the children. So in our contents, it is important that HMS portal is the one which is giving us this information, and it is being used at the national level, at the state level, and at the district level for data for action. So and it also give the the program managers who are accessing this data, so that they can use that for the decision making. So I completely agree that use of the electronic information, information register is very important in such situation where if we get the data in the right time, the action can be taken as quickly as possible. I will stop here. Thank you.
Thank you very much, Dr. Preetu. And I think we'll have a little bit, some more additional questions on data quality in a little bit. I did want to come back, and I've seen people have put this in the chat as well, but Amos, there is another question for you specifically on vaccine management, and it's really in anticipation of the COVID-19 vaccine. What should countries be doing right now to help prepare for the introduction of that vaccine. Can you talk a little bit about some of the planning that countries can be doing right now?
Yeah, thank you, Lisa. Again, COVID vaccine, as it comes in, is going to have a significant impact on countries' cold chain system, because as it comes in, it will require to be managed within the existing cold chain, and therefore one area where the manager should be looking at is their infrastructure. How does their cold chain look like? How is their cold chain inventory like? What do they have? What do they need more? Yeah, I think this is one of the areas, because without the cold chain, then you may not have to store the vaccine. So they must start thinking outside the box, even if they have to use another form of cold chain to store that vaccine. They must start looking around and see what is available outside their existing cold chain for vaccines, so that this vaccine can be stored there. As we are aware, as we have been looking around, and the information coming out that this vaccine may require to be stored at very low temperatures. So it will be very important again to look at their freezers, the low temperature storage, the minus, the negative storage. We need to look at what is available. And this will be in relation to who would be their priority to be vaccinated, who are the most at risk within their countries that we require to be vaccinated. Where are they? So that they can start mapping the cold chain facilities where those populations will be. So I'm sure issues of health workers will come in, the elderly and the aged will come in, but we again need to start prioritizing. If this is what is coming out, then where are we going to store this vaccine? What vaccine are we expecting? Where shall we store it? Yeah, I think that is the most important thing people should start looking at, is where that vaccine will be stored. I think that's the basic thing I think people should be looking at the moment. Over.
Thank you. Yes, because we really have no idea what the presentation will look like, and as you were describing, because we're going to need to prioritize the highest risk groups first, and think about mapping cold chain for that. So likely urban areas will likely be prioritized, although it will depend on each country's perspective. And really the unprecedented need to reach every single person, all target populations with the vaccine, that's something that's new to countries and that they need to be thinking about now. Thank you, Amos. So this last question for Dr. Betwell before we head to Dr. Pritu. So we've talked a lot about how to design response planning and strategies that we can be using. Are there, and you've talked a bit about this, but can you just point out some very specific changes or adaptations that you're making because of COVID-19 when you design your catch-up plan? Can you just highlight those few things for us again, so that other countries can think about adapting for their country context?
Yes, Lisa. I think it's important to think about the whole plan for the provision of health service, integrated in the primary health care. I think this is important because most of the time we plan as immunization, and we are lack of resource to address. But if done in integrated manner, it will be important. So I think I would recommend that if it's possible, the response plan has to be integrated, and this is not something that you can do for 1 month, 2 months. It will take longer. When we plan, we were thinking that the response, it will be for 2-3 months, but we extend that period. So I think it's important, the country, to take in consideration that have to be a continuity plan for the provision of a health service where immunization is also integrated. It's complex, it takes time, but it's more sustainable if we do in this and also maximize the use of resource. It's also important before moving for the implementation of any plan or strategy to really think in terms of the benefit of use your data, local data, to analyze and identify gaps. This is important. Sometimes we are not trusted because there are issues related with data issues, but I think it's important to use those data to understand what has happened, compare it with the previous period, and then decide what has happened. So situation analysis, it's really important, and then you will identify gaps and the problem. I think this is something that wasn't in the past. We never did the measurement in terms of the impact. We've been accessing the vaccine coverage, we compare the dropout rate, but we never did in terms of impact on any intervention directly in the program. We've been doing something different. So doing this analysis was helpful because we saw something that was really, I mean, we really understand how how can I say, in terms of quantify the problems that we had on demand, on communication, on different key indicators, we saw that something need to be done. I think this is important. So data help a lot to understand what we did on this. And also, I think it's important to set a target and deadline to do the response, because you can monitor on time in which direction you are performing. I think this will be important to set targets, to set deadlines on your response. I heard your question regarding to the quantity of missed children and so on. This is really important because if you don't know, you will lost on the way, and you will not really improving the program. So I think it's really important also to identify the key professional, be involved. There are lack of resources, we know about that, but involving the district manager also can help where you need to really move the health staff to support because of this disruption. Something that we learned on this was related to also that the COVID, usually for the prevention measurement, they use immunization staff. And immunization staff have been allocated to COVID response plan outside of the immunization intervention. We realized that, and it was really difficult to manage, and they have to be taken in consideration. I don't know what's happened for other countries, but in situation that you have a lack of human resource, usually for the prevention measurement at the facility, the immunization staff are used to be in the front line to collect the samples for COVID, to how can I say, to be involved in the communication and prevention measurement within the facility or to the district level. And this is also something that needs to be adapted, because you can be difficult because you are in the lack of resource, and also because of the COVID, most of staff for the prevention are from immunization field is that we face here in Mozambique. Depends on the country. Sometimes you have specific people that work on this, but in our situation, people who are dedicated for the PPE training, collecting sample at the health facility have been involved. This has been involved with the immunization staff. So it's what I can share to learn from, to share as lessons learning for other countries to adapt if they are going to prepare a catch-up plan for the because of the COVID context. Thank you.
Thank you very much, Dr. Betwell. I think those are some really great recommendations. You know, as we move to our last formal question, I'm really struck by the theme throughout each of the presenters' answers, and it's data, 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 and just the importance of data for determining how much vaccine stock is going to be needed. It's critical to understand where the children are being missed and to target resources there. What we've found in some of our countries is just how challenging it is to use the data at country level. That administrative data can sometimes be misleading and hide where the real issues are. And so this last question is for Dr. Preetu. What are strategies, and you've talked a bit about this, with using supportive supervision and other methods to move beyond data quality issues, understand the limitations of administrative data and get a better understanding of what's happening on the ground, and recommendations around data triangulation and or other ways that you are doing this and recommend for our other country contexts. Thanks.
Thank you, Lisa, again. After the disruption, which massively happened during the month of April, so country has built a very strong response system. It is Ministry of Health declared immunization as essential health services and requested all the states to resume immunization service immediately. They also issued many guidance note and how to resume the RI session, and also based on the zone categorization. Immunization Technical Support Unit, we designed a resumption model where, we were doing a weekly interaction with the state immunization officers. So we have like 37 states and UTs. We assigned them among our medical officers who were talking to the state officers and understanding the status of their fixed sites and the outreach sessions. Also understanding from them about the operation challenges they are facing, and guiding them how to overcome some of the issues, and on the same time escalating some of the problems to the national government also. We also decided to download the data, the data from the portal on the weekly basis, analyzing the data and thus guiding and giving feedback to these states that this is how your data is showing up, and this is how you should plan your actions. Apart from this, we also supported states by developing some of the frequently asked questions related to the new normal, and also many SBCC material was developed and shared with them to help them in delivering their task with the ease during this pandemic time. Government of India also instructed states to continue reporting of immunization status, so we understand where we are missing the children and how and what is the strategy states are opting and districts are opting to reach out to those missed children. As I already said, in 3 months, that is April, May, and June, we missed like FIC has gone down by 6 million. Efforts were put towards building confidence among the community. That is very important because a lot of parents are hesitant to bring their children to immunization sessions. So that was taken as a task, and our frontline worker did excellent job in building that confidence among the communities. We also, help developing a lot of other material which help finally in capacity building of the frontline workers so that they are able to deliver the services in the new normal. So this is how India has responded to this pandemic situation and supported the resumption of routine immunization activity throughout the country. I'll stop here. Thank you.
Thank you. So we've come to the end of our structured questions, and I see that there's a number of really great questions in the chat and the Q&A function. So I think we're going to switch gears to start to answer some of your questions. So I'll just ask if all of our panelists can come on video for this last part of the session, if possible. Great, thank you. So there are a number of different questions. I'm just going to start. I think that there's an interesting question, and I'm going to ask, sorry, let me scroll back up. If, and this is for any of you, so please feel free to jump in. But when you were looking at over the past several months, are you seeing places where vaccination demand did not dip due to COVID? And were there any best practices that were taken up from what you were seeing to be implemented in other places? So have you, when looking at the data, were there places where service interruption did not happen? And if so, were there lessons learned from that experience?
I think it's something that's impacting all levels. We did analysis and we focus on district and the health facility. The difference is the size of population. When you compare from one region to another region. So the impact of COVID was across the country. Mm-hmm. And the difference is only in terms of size of the population, that you say that maybe if you compare within your country, we can say this region or this district, maybe the impact is much higher. In terms of, depends also on the indicator that we are looking for. Like the vaccine distribution, maybe it can be, depends on the access, because some partner that have been helping, that this is just from Mozambique, helping in terms of vaccine distribution, also was affected. And some partners also have been working for COVID to respond, not just for immunization, which the traditional one like UNICEF and WHO also engaged, those that have been supporting the program also engaged in different technical working groups for COVID within the Ministry of Health, and also different technical working group wasn't happen at the beginning because to avoid the transmission. And we saw that some health facility didn't get the visit for vaccine distribution, which also affected in terms of service delivery. And also we saw that some area, the quality of data wasn't good enough because of the lack of supervision. So those things depends on the type of indicator that you are looking for, but using the administrative data, you can identify that, no any service that have been, or any region that have been safe. I think the impact was elsewhere is what I can share from my country.
Yeah, and so what we've seen, I think that's really important to note, and from what we've seen it seems as if there's, depending on the country, but a slow spread of COVID across the country. So it may have first emerged or been identified in urban areas, and then it's been spreading. And so where there may have been services that continued without issue, it's now happening in certain parts of the country. It's now happening where different parts of the country are now affected more severely by service interruption. And so we've been finding that as well. Thank you for that answer. So this next question, I think I'll direct it to Dr. Prithu. Can you talk about how in India, how are programs using rapid facility and vaccination home-based record card reviews to identify by name and community who are due for routine immunization and then generate lists to follow up, particularly when we think about doing this for outreach and or for the urban poor? Has there been a ramp up of, or an increased focus really on home-based record and follow up in that way?
Yeah, so I mean, as I said earlier also that India has, developed a very strong response and response in rural and urban both. So it is very important that for us, there were two things. One is that to resume the service immediately wherever they are disrupted. And second was to kind of make sure that those children who we missed are reached out. So for that, I think two things were important. One is to find out the children where we have missed them and to enlist them. Another is, and on the other side was important to kind of build that confidence in the community to come back to the immunization center to get their children immunized, because there was a lot of fear among the community and they were reluctant to visit the immunization session. So that was a challenging task. Wherever the services was not interrupted, in those area also we saw that there is a reluctance in population to come to the immunization center. So like you said that how we are planning to reach out to those children. So government has already issued a notice to the states to kind of in poor urban areas or areas where we have the services are not good, to kind of split the sessions and make sure that multiple sessions are held and we are able to reach out to those children whom we have missed and build that confidence among the community to make sure that those children are coming, they are bringing their children to the immunization session. Over.
Great, thank you. This next question is for, so maybe Amos or Betwell can respond, but it was specific to how are Kenya and Mozambique prioritizing target groups for COVID-19 vaccine when it is available, and what data is used for this strategic decision and proactive planning practices that the country is doing for this?
Sorry,
So,
Lisa.
I'll go first.
Okay,
I did.
so I'll just repeat quickly. So the question is, how are Kenya and Mozambique prioritizing target groups for COVID-19 and what data is being used for this strategic decision-making? Amos, we'll start with you.
Yeah, thank you, Lisa. Now, for Kenya, the discussions have started on when the vaccines becomes available, who is the person who is going to be prioritized. And there's no a Kenya specific way of looking at it. And I think they're looking at the global advice, especially from WHO, that those that are most at risk would be the health workers. That will be a must, I think. And then that will be followed by the elderly, the above 65. I've seen that being mentioned somewhere. And then others will follow. Now, Kenya just did a census last year, And we have categories of populations who are at this age, who are above 60. So they will use that to kind of try to estimate the numbers of those who would be like above 65 so that they can use that to order for their vaccines. Over to Betwell, I think. Thank you.
Okay, I think this is still a lack of information in terms of what will be the specific target group and what will be the strategy to deliver the vaccine. So this is still something that is not part of the technical immunization technical working group yet. In Mozambique, there are specific COVID technical working group, and when we have from the API, the national API manager, that the country committed to introduce, they already sent letter to COVID to Gavi, express the interest of COVID. We just support the API, the national API manager, but we need to also to be integrated to discuss, because there are a lot of things that will impact in the program. Right now in Mozambique, it's something that is still out of the technical working group. Only the API manager who have been invited for this, but usually, as you know, in a normal situation, we have the formal channel where the vaccine need to be introduced, and the NITAC is one of them. But right now, most of NITAC members are in these also COVID technical working group. So I think there are still a lack of information that we cannot really come with decision what will be the target group, because we don't have epidemiological profile from the country to say that this disease is impacting this age group. As you know, there are lack of COVID testing. They are testing, so the positive doesn't mean that is they affected by the disease. We have information in terms of positive, but those most being tested, the country started to test also outside of the facility, and we have a few number from facility level and the hospitalized cases that can provide a big or right picture of the COVID situation. So I think it's something that we still have to depend on global advice from the WHO, not really from local. But we are interested to have this, because that is the really mechanism to introduce the vaccine, and then you can access the impact. But right now, if you introduce, it's still difficult to understand where you have to put the efforts to monitor the impact of the COVID, if the most cases have been reported the positive, but at home or outside facility. Thank you.
Thank you, Amos and Betwell. I think as you were describing, I don't know if you, Dr. Pitu, you wanted to comment, but I think the big thing is that everything is still unknown. What presentation of the vaccine would look like, quantities of the vaccine. You know, I think it's going to vary quite a bit by country, and so as much as countries can, pre-planning is important, but it's we're planning for the unknown, which is the huge challenge. We did just receive a question also, how low is that COVID vaccine stored? And I think that is still not yet understood or determined. It really will depend on the presentation of various vaccines, and they may vary. So we don't have information on that yet. There was, so I don't know, Dr. Pitu, did you want to comment, or I think we can move, maybe, go ahead.
Yeah. Okay, thank you. So, I mean, India is now moving towards, developing a framework for the COVID vaccination, and we are just waiting whenever we are going to have vaccine candidate available for it is important for country like India to prioritize. I mean, because when we are talking about India, we are talking about 1.3 billion people. So it is important to prioritize population depending upon, we don't know at the moment which candidate is going to be there and what is the quantity that will be available for us. But it is important for us to develop a framework where, I mean, it is important for us to make sure that we prioritize the population, that is number one, and population who we will be deprioritizing to make effective communication to them that they should not worry and wait for their turn. So these are some of the important tasks, and it is also important to kind of make ourselves ready with the planning. And for that, I think what is important is to have the operational modules and training modules and communication plan in place. So India has already formed subgroups where partners are also participating, and ITSU is anchoring these small groups and helping government in quickly coming up with the framework so that we don't lose time. As soon as there's a vaccine which is available, we immediately move into mass vaccination, depending upon the strategy or depending upon the number of vaccines that is available and how we prioritize it to those groups. So currently we are working on this. Yeah. Thank you. I will stop here.
Great, thank you. I think we have time maybe for one more last question. So this one was directed to Dr. Betwal. Can you talk about how social distancing has impacted the interpersonal communication methods when conducting mobilization activities? Can you speak to that? So when, how has social distancing impacted the ability of health workers to communicate during community mobilization? Oh, Dr. Betwal, you're on mute.
Yeah, sorry. Sorry, I was speaking on, and sorry because sometimes I have a background. I'm in the hotel where I was participating in the joint appraisal or multi-stakeholder dialogue today. And so I didn't have chance to go back to the office, so I'm in the hotel. Sorry about the background that you can hear from this call. And just I did evaluation this year regarding to this topic, and the interpersonal communication. It's a really problem because of lack of skill of the health staff. This was mentioned in different interview that JSI conducted in the country, and needed to be prioritized and 2020 on the next planning. And with COVID, I think this was worse because not because of the social distancing a lot, but also combined with other insistent challenge that the program was facing. So before COVID, this was really critical, and we don't have the real figure how big it was because of the COVID. But even before the COVID, we heard from the interview that the communication was a problem because it's not part of the curriculum of the most of immunization staff that need to be included. For those are already engaged or are working at the health system, need to be well trained to prioritize. And also there are, in the interview, we found that there are issues related with the time to provide and the week of facility to provide this, because most of vaccination are conducted in a place that is not really possible to provide a good interpersonal communication. But this we find is excuse because can be provided even if the staff are well trained and in not even the condition is not, infrastructure are not good, they can do that. But I think motivation also was additional one. So I don't have, information that the COVID increased the problem, but I think it can also contribute to provide to limitate the communication because of social distance. But I don't have the real figure. But we have before COVID that this is really important.
Yeah, absolutely. And it's so important for countries to provide their health workers with guidance on how to talk with communities, and also to, you know, to train health workers on this. But then, of course, you know, how do you effectively train health workers when you can't congregate large groups of people together? And so thinking strategically about how to get that type of information to health workers and efficiently in a way that's safe as well has been a challenge. Yes, thank you. So I think we're at time. So we've gotten to almost all questions. There may be a few left, and I think maybe we can respond to those through the supervisors learning group. And I would also suggest that if there are other questions for our panelists, that we can continue to have that dialogue on the Boost platform as well. So I'll turn it back over to Liz to close us out, but just a big thank you to our three panelists. Thank you very much for taking the time to be with us and to share your insights from your country programs.
Great, thanks so much, Lisa. And I just want to ditto your thanks to all of our panelists today for taking out time to share out their experiences with our community. And like you mentioned, we'll also have some resources available in that supervisors learning group. In particular, Dr. Preetu has kindly shared some materials from India and some of their efforts in strategic planning documents moving forward during this time. So would encourage you all to take a look at those materials again in the supervisors learning group, and we'll also be sharing more in the coming weeks and months. And I think with that, that's all I had on my end. I don't know if Lisa, you had anything else for any of our speakers. Mm-hmm.
Yeah, I'll just say in closing, and then I'll let our speakers say so, that as the pandemic continues, as Dr. Betwal was saying, there needs to be continuity planning, continuing planning, and so the situation will continue to evolve. So I encourage all of us to continue to dialogue with one another, to share out our experiences, and you know, I hope that the supervisor learning group can be a platform for that. And so I hope this is only the beginning of this type of engagement, and I encourage all of you to continue to contribute your great questions and your experience. Thank you for those of you who contributed your experience in the chat as well.
Great. Well, thank you all again. Thank you for our participants also for taking out time from your day. I hope everyone enjoys the rest of their morning, afternoon, or evening.
Thank you. Thank you very much.
Thank you.
Thank you.
You.